One time I took 30 Drix orals, 14 aspirins in one day, and still didn't get rid of the headache.
It was every day, all day I could have been on drugs.
Medical doctors want to do is feed you full of pills, you know, which I take those and I feel like there's 2 or 3 of me, you know, which you can't do anything anyway, you know, except sit and talk to yourself. I go, I can literally carry on a conversation because he keeps looking at me. Hey, Kirk, how are you? You know? Oh, hey. I literally just felt like I just kind of shifted and there's 2 of me now. It was crazy, so I took the 1 pill, but no more.
Then they decided he had reflux, so they wanted to put him on reflux medication. And I said, well, I'll try the medication for a week. If I don't think it's doing anything, I'm taking him off of it because I know the side effects of that kind of medication and I don't want my son on that. Sure enough, it drugged him up, it made him lethargic and tired, but he kept spitting up the food still, so I quit giving it to him.
I was on so much medication from my regular doctor, whom I saw every 3 months, trying to get me well. Nothing worked. The Stanton drugs are so deadly, I tell you.
Drugs in my lap, prescription sample drugs, and say, now will you stop crying? So you can only imagine what I did with the drugs. I threw them in his face and I left.
After I'd taken it for 5 months, the headaches came back. The doctor says, well, we got to take you off that pill anyway, it could kill you. I was probably spending $150 to $200 a month for aspirin, Sunutabs, Drexoral, you name it, I took it.
I am not on one medication now from a regular doctor. None of that. I don't take high blood pressure medicine. I don't take the sugar diabetes pills.
Somebody tells you, well, it's arthritis. Well, it isn't arthritis. Or they'll tell you you've got fibromyalgia. Well, you don't have fibromyalgia. What you have is a misalignment that started to twist the spine, and it started to lean the spine, the head, and the neck out of the vertical. And the body starts to lean, and as it starts to lean, muscles will tighten up, pelvis will twist, shoulders will change their position, trying to get you back up to vertical. And a certain torquing force begins to show up in the spine. What most chiropractors are trying to do is they'll find segments of the spine that seem fixated in their ability to move through a normal range of motion. So force is applied at that area to free that segment up. My orientation is to correct body posture, and most movements out of normal of the spine from a normal position, and there is a normal position for the spine, is brought on by reflexive mechanisms that occur between the first and second bones of the neck that affect body posture. Medicine, and thank goodness it exists, is concerned more primarily with acute problems. What I'm concerned with are the chronic problems. The problems that started off as a little tiny ache or a little tiny pain, a little catch in the get along, that comes and goes.
Being a nurse and working on rehab for 25 years, I didn't really want to, you know, you see these things on TV of chiropractors where they take people's necks and rip them off their heads and rip them off their shoulders, and it's like, I said, I can't let you do that. I've been working with spinal cord injuries too many years. I can't do that. I can't let you in there. I didn't know Jack was different. And my husband kept telling me, no, he doesn't do that. And it's like, he's a chiropractor, of course he does. And it's like, no, this is NUCCA, it's something different. And I'm like, and that took me a year to get convinced to let him come in.
But a medical doctor could not have helped me. I had no open injuries that you could fix.
I have been to every kind of a doctor there was. You know, they crack your back and shift you around, and it's too hard. I think it was too hard on me.
I had spent thousands and thousands of dollars trying to get rid of the headaches. I'd been to neurosurgeons, had CT scans, MRI scans. I had several neurologists put me on pills.
And I would go to chiropractors. I started chiropractors in late 72, He was very rough. It hurt when he adjusted me. It was crank and pop. And
I was surprised because I had been to other chiropractors. I was surprised that he didn't start jerking my neck around. The experience was you know, really easy on my muscles, on my back.
I'd gone to my doctor. He gave me pain pills. I had tried physical therapy. Nothing happened. I went to the neurosurgeon. The neurosurgeon basically told me that they were pretty sure it was a herniated disc also. They would schedule an MRI, and at that point it was discovered that I had 3 herniated discs. I had fragments floating also, and they figured the only option I really had was to have it operated on.
Significant problems, can't move, laying in the hospital bed. I have this doctor looking at me telling me that basically my life is ruined at this point. He really, really honestly said that to me. And he says, I need to come and see him the next day and start talking about surgery options.
I went to a chiropractor. It had worked for a week, maybe 2 weeks, and then I was back out again. This is the only time that I can tell it's holding. It's really beginning to hold, and it's wonderful.
So I took him into his pediatrician, who I love. They diagnosed him at 4 months old with torticollis, and what that is a shortened muscle in the neck. So they sent me to physical therapy to have his neck stretched. They said call Primary Children's and they'll schedule an EEG, and if they find anything abnormal, maybe he's like got epilepsy or something, or maybe he needs to be on convulsion medication. So I listened to them and I took him to physical therapy. I watched them stretch his neck and twist his neck, and he started to cry and get really upset, and I remember saying to the lady, you know what, that looks like that hurts to me. He looks like he's in pain, and she said, oh no, he's just really mad. So I kind of just gave up on taking him to the doctor and them going, well, I don't know, you know, bless their heart.
I had gone to a normal chiropractor, and I went in there and he totally hurt me, and I said, well, I still can't turn my head. And he said, you're just going to have to come back a couple times this week. So I went home, my husband said, no, you're going to go try Dr. Stockwell.
My job in this clinic is to bring that head and spine back into structural alignment, to bring the head back into the vertical, to get the neck vertical underneath the skull, and to get that top bone perpendicular to everything. So what I do to bring everything back into balance, I take 3 films of the head and neck from 3 different directions. I analyze those films. They show me where and how I want to place you on a special table on your side. And while you're lying motionless on your side, I bring this bone in my wrist right here against the top bone in the neck right here with all of about 1 ounce of pressure. You hardly even know that I'm there, except you start hearing some clicking sounds. And I'll do that over and over and over again on that very, very specific pathway that those x-rays tell me until I feel your neck and back relax. At that point, we go back in the x-ray room on the first visit and repeat 2 of the first 3 pictures to make sure I brought that head and neck back into structural balance. If I didn't, those follow-up films will tell me what I need to do in order to do it. But if I got it, as soon as you stand up and walk around, you're going to know that something is very different.